This video is part one in our educational series on how to utilize a conservative treatment approach by treating soft tissue restrictions for a client who has degenerative disc disease of the cervical spine. In this video, I will cover the following. What does degeneration truly mean? Common types of disc degeneration that clients present with, why a diagnosis of degenerative disc disease isn't something soft tissue providers should be afraid to treat, and why do conservative soft tissue-based treatments have a better outcome than surgery in most cases. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a soft tissue injury treatment expert specifically for chronic neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain without the use of drugs, injections, or surgeries. This leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I'm also the creator of the PEAK method, where we teach overworked manual therapists a new injury treatment system that eliminates the frustrations of not getting consistent results, allowing them to reduce their treatment times by at least 50% and easily double their income. All right, so why am I creating this educational series and what's going to be included in it? First off is, why am I only doing the cervical spine? As I say in my introductions, most of what I see in my clinic is neck, shoulder, and upper extremity issues, and I just have a lot more experience in specializing in these areas. And I'm also seeing that treating a cervical disc problem has a much different approach than treating a lumbar disc problem. I'm seeing a lot in my past instances in my practice when I was doing lumbar treatments and things like that. There was such a bigger component to like corrective exercises and things that the client also needed to do from home in order to participate in the process. And lumbar discs are just a whole different beast in a battle. And I really just enjoy treating the cervical spine. It doesn't take as much wear and tear on me as a provider. There's a lot of people that have neck pain that aren't getting it resolved at all. I do think some other types of treatments for low back pain can have some decent results that aren't always soft tissue based, but I haven't seen anything that isn't a soft tissue focus actually help a cervical spine disc issue. So that's why I made it. And it's going to be all about cervical spine. There are so many clients that have them, and most providers don't even understand them or even look for them in the injury presentation. And then if they do get them, and like say it comes in and they got a diagnosis from a medical doctor or an orthopedic or an MRI and they see it, they don't even want to take them on or evaluate them. And then these people are kind of just stuck being in pain and not really getting any true answers as to what's going on and getting the help that they need. It's going to be a few parts. This is going to be part one, and we're going to understand what degeneration actually is and the different types of disc injuries. In part two, I'm going to go through clinical signs and functional testing to know if the client is presenting with a disc injury and what to do to know exactly where it is and how you can dictate the treatment in the right way. Part three is going to be advanced palpation and functional based treatments of the most common causes of dysfunction around a cervical disc and how to palpate them, how to treat them, and get some pressure off of there and get things functioning better. Part four is going to be changing the client's limiting beliefs around degeneration and helping them through the process. A lot of this is mental with the client, where they just want to be married to their diagnosis and just think that nothing can happen, and they get in a very nihilistic type of approach, kind of helping you be more persuasive and influential to help them see this all the way through. And lastly, part five is going to be proper load management and corrective exercises to maintain the progress, because once we get the tissue cleaned up, we need to get it stronger and moving better so that these problems don't progress and get worse. So cervical disc, let's start with the cervical disc. There's 7 of them in the upper part of the neck in what's classically considered the cervical spine. So the function of the disc is it's really designed to be like a shock absorber. It can handle force coming down, really good at that. Protects and cushions the joints in the disc, not the joints and the motion in the spine. Really, really important jobs, and just gets beat up in modern society. So why does it get damaged? So over time, with a more sedentary posture in a society where we're, stuck working at a computer, looking down all day, maybe not moving as much as we should, the muscles around the area develop a lot of adhesion. I talk about adhesion all the time, also known as scar tissue. Essentially what it does is makes the muscles less flexible and weak, and then eventually it gets stuck to the nerves, and then it gets stuck to the ligaments, and now those muscles and ligaments can't generate the normal force that they should, so they put more pressure on the disc. So instead of the disc kind of having like that downward force, it actually starts to kind of slide and grind on itself. And when it does that, it really causes more damage. The disc isn't designed to do that. And it loses a lot of its function and its stability. And then the fibers inside the disc get really beat up and then get damaged and get that degeneration that we see. What does degeneration truly mean? Sometimes it's a big, bad, scary word. When I'm talking to my clients, I just say, degeneration is just a general term that things just got older before their time. And you tend to see more degeneration in what I call structures. And there's 4 structures that can get degeneration in a musculoskeletal issue. One's going to be bone, one's going to be cartilage, one's going to be disc, and one's going to be tendon. And usually those happen because other things around there aren't working correctly. Next is an MRI is the only way to know for sure that we actually have a disc injury in there, because an x-ray just can't see it. I see a lot of people come from like the chiropractic realm where they got an x-ray and they're like, oh, you have degenerative disc disease based off of that. I mean, you can possibly make that inference, but you have to get the full MRI to really know for sure what's going on. And the x-ray isn't going to tell us, because the x-ray can't see the disc. It just sees a space, but it doesn't tell us like what type of disc injury it is, where it's at, where it might be compressing on the nerve. So we need to have that MRI to confirm for sure that the client does have it. So there's all different types of discs, but let's just start here. I have a nice diagram of what a disc looks like. First is like, what is it made up of? So in the inner part here is what's called the nucleus. It's like the jelly of the disc. And then it's surrounded by all these fibers, which are actually considered ligaments. They're called annular fibers. And then it has like the outcoating of where it goes. So middle is like the jelly-like, the annular fibers protect it, and it like kind of seals it in from what we see. The first type of injury that I usually see is when a client has their first episode of a disc problem is what's called an internal disc derangement. So these are really acute, and it's when it's first starting. So what happens is, when we talked about when the disc can't support itself how it's supposed to because the muscles and ligaments are dysfunctional, it puts more pressure. So then you start to get inside of these fibers in here called the annular fibers. You start to get these little micro tears, and you get these little tears in there. And sometimes when that happens, this is where the client might wake up and they're like, holy cow, I can't turn my head. I'm getting like really sharp stabbing pain in there. Usually internal disc derangement lasts anywhere from like 2 to 10 days. And then a lot of times it just kind of resolves on its own. It's never actually better, but then what will happen is then they start to get them more frequently, more often, more intense. And that's just showing that more and more of that pressure is coming on the disc. But that's the most common one that I get, and that's what you're usually going to see is when you get that client that calls you up and they're like, oh my God, I can't turn my head. I'm having shooting pain. I must have slept on it wrong. More than likely, it's what's called an internal disc derangement. And a lot of times you just need to let those kind of chill out for a little bit, but everyone wants to jump into the treatment on that. I don't recommend that. I kind of let it chill out for like 3 or 4 days. Then I'll go in there and kind of see what's going on, because there's going to be a lot of inflammation to start. Next one is just going to be bulging. So that's going to be this next one here where you're seeing this blue and red come out. So basically what happens is you get enough of the tearing into the area here. And basically what happens is now that fiber can't do what it's supposed to. And then this jelly-like substance starts to come out. It's probably the most common that we see, bulging on an MRI. And a lot of times people will have bulging on an MRI report, and the radiologist will actually downplay it because a lot of times they're younger and they're like, oh, well, it doesn't really matter. You're young, it doesn't matter. But that client came into the office because they're in pain, so the bulge does matter. Next one is going to be a protrusion, where it comes out of the bulge and then it actually comes outside of there and starts to break free, and it's on its own. These ones are really bad. Usually they're in like a lot of pain, a significant amount of pain that really just doesn't go away. Over time, they tend to be the biggest problem because they're still kind of attached to the jelly, but they never actually break free. Next one is going to be an extrusion. It's where this actually breaks free and it sits out there. These ones are really bad. That's where they're going to have like neurological problems and issues where they might lose function down the arm. In the short term, they really suck. They're really painful, but long term, actually, the body cleans those up a lot better. And then the same thing was what was called a sequestration. That's where it really breaks free as well. And sometimes these can be an emergency if they're sitting on the nerve for too long and compromise that. But a lot of times these ones will actually have a better long-term prognosis because the body will go in there and clean them up eventually. But these are the different types of disc injuries that you're going to see. So why is the diagnosis of degenerative disc disease isn't something you should be afraid of as a soft tissue provider? Number one is just cause and effect. So a lot of times people will get these MRIs and they'll get scared and the doctor will be like, you got degenerative disc disease, you need surgery, you need injections, you need all that. But a lot of times what's actually going on is the disc injury is actually the effect and the cause is actually all of the bad tissue that surrounded it in there. And it's really not as scary as it sounds. It just has a bad name, degenerative disc disease. And people are like, oh my God, I have degenerative disc disease. It's not as bad as you think. But it still is something that can really suck and really be lingering and chronic for the client. So why do conservative soft tissue based treatments have a better outcome than surgery in most cases? Really, one thing is the only type I don't usually like to treat is a direct trauma or accident, especially one that's like 6 months out, because a lot of times such a huge force went in there and that disc is so damaged and inflamed that we just kind of let the body kind of chill out a little bit and let it do its thing and heal up a little bit. Then we can go in and treat it because a lot of times it's so freshly acute. There's so much inflammation there. It's actually going to be a lot worse trying to treat it in that spot. So I usually don't like to treat people that were in direct accidents or had any direct trauma there, especially 6 months out. If it's been more than 6 months, yeah, I'll go in there all day, but I don't like to be in that acute phase. Next is a surgical risk. These surgeons make it out to people like, oh, we'll just go in there, we'll seal some stuff up, you're in and out. They don't talk about any of the risks that you could get an infection. You could have a reaction to anesthesia. It could actually make the problem worse. And even in some cases, you can actually die. So there's a lot of risks involved with surgery. I always talk to my patients about this idea and my clients is think of your disc as like your thumb and it's stuck inside a car door. The car door is all of the bad tissue around there. We can't give this a chance to heal up until we actually remove that. There's a really good book. I always forget what the name is, but it was written by a spine surgeon who basically did all these surgeries for years and realized that his clients were getting worse, having poorer outcomes. And then he started to realize that the pain generator wasn't actually coming from the disc, but the actual surrounding tissue. So he really got into like getting them to get the tissue healthy, cleaning up the diet, cleaning up the stress, getting it moving and stuff like that, and realized that the surgeries were really, like I said, just going after the effect, but not getting to the true cause. And here's the thing, even if they have surgery or they're trying to think about surgery, they still need to get those tissues healthy and function better. Because like I said, it's like that car door, stuck in the car door analogy. If we pull it out of the door really quick, but we never actually fix that door, it's going to slam right back down. So that's why you're seeing things like failed neck surgery and stuff like that, where people jump right into the surgery, but it's not actually fixing the problem. And it's why people have an epidemic of neck pain. So that's all I got in the video. I appreciate you watching. Share any insights you might have gotten in the comment section below. I try to respond to those the best that I can and give any insights that I can. Also, you can do me a solid and share this with other providers that might want to help, want to do some good work and change their perspectives and really get into more of like solving chronic pain. And lastly, you can go and download our free training modules where we go through everything from neck, mid back, shoulder. We give you all the evaluations, all the treatments, all the palpations, everything you can think of to really help you become a better provider, do your treatment more effectively, quicker, and get better long-lasting results. All the links to that are wherever you're watching this video in the description box below. And I want you to continue to watch and stay tuned for the other parts in this video. And I appreciate you watching, and I'll catch you on the next one. Bye.